Okay, so for this first exercise is just going to be a hill slide. So normally in like the hospital setting or even in a clinical setting, you would have them take off their shoe and you could place it either on like a slide board with a towel or a rag under their foot or on the floor with a rag or towel. However, with my situation here, I'm just going to be using my rug because it's easier and I have a sock on. So normally you would do this about 20 times. However, for video purposes, I'm only going to do it 5. So they're going to be sitting in the chair and all they're going to do is slide their foot out as far as they can go and then bring it in as far as they can go. And you don't want to do this where it increases pain and you constantly want to ask them, are you hurting? Is there any pain involved? Is this increasing symptoms? Is this decreasing symptoms? And everything like that. And then that's the hill slide. So then next what we're going to do is we're going to do a long arc quad. So they can be seated most of the time after hip replacement patients, no matter if it's anterior or posterior. After they come out of surgery, they normally are in a recliner. So they are seated just a little bit down, especially for posterior. And all they do is they just raise their leg up as straight as they can and then right back down. So normally you want to shoot for 20. You can do this in breaks, so 2 sets of 10 or just 20 outright, just depending on the patient. And for video purposes, I'm only going to do 5. Again, you want to ask the patient constantly if they're having any pain, if this is increasing or decreasing symptoms, everything like that. Okay. Alright, for this next exercise, we're going to do a quad set. So basically, all you're going to do is you're just going to have the patient try to push their knee into the table, the bed, the chair, wherever you're seated. Sometimes it helps at first if you put a towel roll underneath their knee in that popliteal space just so they can visually see it being pressed into the table. So all you're going to do is you're going to have them do a quad set. So then you'll see the muscles around here tighten, and especially because it's working your quads. And you're going to hold it for about 3 to 5 seconds and then release it and then push back again, hold it for another 3 to 5 seconds and do that. Again, for this one, shoot for 20. Sometimes you can do it in breaks, 2 sets of 10, or just however the patient's feeling, and don't go over. If the patient starts to just press down like this, then just stop because it's not effectively working. So yep, just press down, 3 to 5 seconds, release. So the next thing we're doing is a short arc quad. The patient will be lying in supine with a bolster or a towel roll or something that helps prop the knee up. I'm using a pillow in my case. And all you'll do is, just like the long arc, you'll just bring that foot up straight. Again, for this, I shoot for 20, 2 sets of 10, or however many the patient's comfortable with. And you just go straight with it. So it's not as intense as the long arc quad because this is a much shorter distance. Always ask for pain management and see if it's helping or decreasing symptoms. Okay, this next one is the same as before. It's just another hill slide. Again, for this, you can have a sliding board with a towel or their sock, or just anything on a smooth surface where it's easy for them to move their foot, and make sure you take off their shoe. So for this one, you're just going to basically do what you did when you were seated and just bring that heel back as far as you can and then go all the way down. So as far up and then down. Again, I go for 20, 2 sets of 10, or however many the patient can handle. And always ask about pain and stop if the pain becomes too intense. Okay, for this next one, it's going to be an active assisted hill slide. So the patient can be laying down, they can be seated up, however they feel more comfortable. So this one sometimes is a lot easier than just the active hill slide. So all you're doing is you can have a towel, a bed sheet, anything that the patient can grab onto. And all they're going to do is just bring that heel back as far as they can and then go up. Sometimes this is easier just because it gives them a little extra pull and they can bring that foot back a lot farther with the active assistive than with just the active. Again, you want to shoot for 20 or 2 sets of 10 or however many the patient can handle due to pain.